Kristen here with Milk Diva Lactation Services. I just wanted to bring a quick video and discuss a topic that we commonly hear about, which is nipple confusion. So, nipple confusion is identified or labeled as when a baby is having a hard time latching to the breast or staying latched to the breast. Oftentimes, nipple confusion is actually something that we also call flow preference. Flow preference is when a baby is used to a specific flow that often comes from the bottle and they are unwilling to remain patient at the breast and maintain that latch to get the milk to begin flowing. So one way that this happens is when we're using bottles that are too fast of a flow. Most bottles are labeled slow flow, but whether or not those bottles are actually slow flow is a total different game. What I wanted to talk about today is how we can use pace bottle feeding to help babies who may have developed a flow preference. One thing that we'll do when we're going to use a pace bottle feeding technique is first we're going to check out what kind of bottles do we have. Is it actually a slow flow bottle? Today I have represented an even flow balance bottle. Another thing that we're going to want to make sure is we're going to want to make sure that our baby is actually latching to the bottle properly so that they can mimic that behavior at the breast. So what we would do is we would tap our baby's upper lip so that they can open and latch onto the nipple instead of placing the nipple directly in their mouth. Another thing we're going to do is we're going to allow baby to suck on an empty nipple for 5, 10, maybe even 15 times before we allow milk to enter half the nipple tip. So this is one way that we can help start training baby to have more realistic expectations of flow at the breast. Second thing that happens that I see often is baby having a difficult time feeling the nipple on their palate. And so something that can help with this is one, meeting with a lactation consultant, B, working on latch and positioning, making sure that we have a good angle and alignment for attaching baby to the breast, and then in a way that they can feel their nipple. And then other things that we can do are things like reverse pressure softening to help soften the breast tissue so that baby can latch a little bit easier, a little bit of nipple rolling if we need to harden or firm up the nipple just a little bit so it's a little firmer of a grasp. Those are some things that we can do in order to help baby feel the nipple on their palate before latching. Sometimes if you're working with a lactation consultant, they'll also deem that having a nipple shield is something that could benefit you and your baby. But again, that's definitely something that you would want to do under the care of a lactation consultant so we can make sure that your baby is able to take milk from the breast properly with that tool in place. So I hope that helps kind of clear up some questions that we have about what nipple confusion is, whether or not my baby has nipple confusion, or if we're actually dealing with some other things like flow preference or needing that firm palate stimulation. If you have any questions or you need any help, we'd love to help you, and please don't hesitate to reach out, okay?